Hello, how are you? How is your day? How is your evening? How is your night? And how is your place of work? Are you under any stress? Are you feeling okay? Today, I want to show you how to do a self breast examination on your breasts. You remember the prosthesis that we made the other day? Although I'm not perfect, one can also use pieces of clothes as long as you feel comfortable in them. You might not necessarily have to use these carrier bags. You can also use the either a piece of cloth. Welcome to my channel. If you're new there, kindly subscribe. Hit the subscription button, then the notification bell so that you're notified as soon as I upload any video. I am Kate. I'm a nurse by profession. And today I have decided to take you through breast examination, that is self-breast examination. The main goals of doing this self-breast examination is to check whether you have a lump that can progress to be cancerous. So to start with, usually go to in your bedroom or somewhere there is a mirror. Then you remove all your clothes, including the bra. After you remove your bra, go in front of a mirror. After you go in front of a mirror, lift up your hands. Look whether the breasts are equal in size. Look whether there is any discharge, whether there is any dimple, whether there are any swelling along on the breast, and whether the nipple is inverted. Okay? And you also want to see whether at the edges they are also equal in size. So you need to turn, look, then you turn on the other side and you look. Then you bend down and let the breasts hang on their own like that. Then you check in front of your mirror whether your breasts are hanging equally. Okay? So you should stand, bend, let the breasts hang, see whether they are hanging freely and equally. So when you want to examine your breast now in a bed, you lie flat in a supine position. Then you place your hand behind the head, divide the breast into two parts. There is upper outer quadrant, lower outer quadrant, inner upper quadrant, inner lower quadrant. You want to check your left breast, you place your left hand behind your head, then divide the breast as we did to the right breast. There is upper outer quadrant, lower upper outer quadrant, upper inner quadrant, lower inner quadrant. Then you finish with the nipple. You divide your breast into those four parts. You now go and start examining your breast from the armpit. You come down while palpating in a circular motion. You come up to until the level of your breast. Then you feel there is nothing. You come now to the upper, you palpate. The other upper outer, you palpate. Lower outer, you palpate. Lower inner, you palpate. Then you finish with your nipple. Come to the right side. Ensure that you palpate the armpit coming down towards your breast. Then you reach to the upper outer quadrant, you palpate in a circular motion. Lower outer quadrant, you palpate in a circular motion. Inner outer quadrant, you palpate in a circular motion. Inner upper quadrant, you palpate in a circular motion. So a quick self-breast examination, as we said earlier before. If you want to start with your right breast, place your hand behind, the right hand behind your head, like that. Then you palpate using the palm. The other part of the hand, you divide your breast into four parts. but you are now going to start with the armpit. You come lower to the upper outer quadrant, then to the lower outer quadrant, to the inner lower quadrant, and to the upper inner quadrant. When you are done with palpating all that, you now come to the breast, and if you're not breastfeeding, you can press the nipple to see whether there is any discharge. Then place your left hand behind your head. You now use your right hand to palpate your left breast. Start from the armpit, going down to the upper outer quadrant of your breast. You palpate in a circular motion. You go to the lower outer quadrant of your breast. You palpate in a circular motion. You go to the inner lower quadrant of your breast. You palpate to feel whether there is any lump or any abnormality. You also palpate upper inner quadrant of your breast to feel whether there is any abnormality. Once you are done, you go to your nipple, you press it, then you can press the nipple to see whether there is any discharge. And if of course you are breastfeeding, it is only milk that will come out, that is white in color. But if there is any other discharge, you're supposed now to go to the hospital set up for checkup, so that you can easily detect any cancerous lump for easier and faster diagnosis and for quick treatment, so that you can save from progressing to the next stages of breast cancer. Goodbye and have a good time. Take care of yourself.